I have to be honest with you about something I probably should have said out loud years ago. I have been a practicing physician for over 2 decades, and the conversation I am about to have with you is one my colleagues and I tend to avoid at dinner parties, in conferences, and sometimes, I am not proud of this, even in the exam room. Because millions of people over 60 are doing something every single morning they believe is the right thing for their heart. Their doctor may have even nodded along when they mentioned it. They feel responsible. They feel informed. What we now know, and what the research has quietly confirmed, is that some of the foods most widely trusted as heart protective are, for a body over 60, silently doing the opposite. The specific damage they cause is not dramatic. It does not announce itself. It builds, slowly, in your arteries, your blood pressure, your inflammation levels, until one day it does announce itself. And by then, the window for easy correction has often closed. I want to change that for you today, right now. And here is what I should have told my patients years ago, that the danger is not always hiding in the foods we think of as bad. It is hiding in the foods labeled good. After 60, your body is not the same body it was at 45. I know that sounds obvious. But what most people do not realize, and what most health content never explains clearly enough, is that the biological changes happening inside your cardiovascular system after 60 are specific, measurable, and they completely change the way your body responds to certain foods. What is happening to your arteries right now? Before I get to the specific foods, I need you to understand something about what aging does to the vessels that carry blood to your heart. Most people imagine their arteries like garden hoses, flexible, open, resilient. But the reality is far more complex than that, and far more fragile. Cardiovascular disease remains the leading cause of death among seniors, and the risk of developing it increases with age due to factors such as arterial stiffening and increased blood pressure. Those arteries that once bounced back easily, after 60 they stiffen, they narrow, they become exquisitely sensitive to inflammation, to cholesterol deposits, to pressure spikes. And here is the part no one tells you plainly. Foods that a 40-year-old body handles with minimal impact can, in a 60-year-old body, accelerate every single one of those processes. After 60, the body burns fewer calories and metabolism slows. Arteries naturally stiffen so that salty foods further elevate blood pressure, and aging livers process fats less efficiently, making saturated and trans fats far more harmful than before. I had a patient, a retired school principal, 68 years old, who came to me utterly confused. He had been eating what he called a clean diet for 10 years. Oatmeal, whole grains, yogurt every single morning. He exercised twice a week. His numbers were getting worse, not better. And when we looked closely at what he was eating, we found the problem. Not in the junk food he was avoiding, but in the health food he trusted completely. That discovery is not an outlier. It is a pattern I kept seeing over and over again. And it should concern every single person over 60 watching this video right now. The part of this story that still bothers me is this. We have known for years that food choices drive cardiovascular outcomes. Diet profoundly influences cardiovascular health by affecting blood pressure, cholesterol levels, inflammation, and weight management. But what the research has more recently made clear, and this is where it gets personal, is that the standard healthy eating advice was largely designed around middle-aged bodies, not bodies in their 7th and 8th decade of life. So what is actually happening when you eat something and your heart pays the price? Let me walk you through the biology, because understanding this will change the way you look at your plate. Inside your body right now, your liver is doing something remarkable. Think of your liver like a sorting facility at a shipping warehouse. It receives fats from the food you eat, packages them, and sends them into your bloodstream as tiny carriers called lipoproteins. The most important of these, for our conversation today, is LDL cholesterol, low-density lipoprotein, which you can think of as the delivery trucks that drop fat off at your artery walls. The role of lipids and lipoproteins as causal factors for cardiovascular disease is well established. Dietary saturated fatty acids increase LDL cholesterol, and the increase in LDL is due to a decrease in hepatic LDL clearance and an increase in LDL production. Now, here is what changes after 60. Aging livers process fats less efficiently, making saturated and trans fats considerably more harmful in older adults. Those delivery trucks are running a compromised route. The clearance system is slower, so the LDL lingers longer, deposits more, and builds up in artery walls at a rate that would not happen in a younger body eating the same food. I had a patient, a 71-year-old retired nurse, of all things, who told me, "I know nutrition, Dr. Swensen. I spent 40 years in healthcare." And she was right. She did know nutrition. She just did not know that 3 of the foods she ate every week were working against her specific cardiovascular profile at her specific age. That distinction matters enormously, and what the first food on our list does inside your aging arteries, that is where this gets very real. I wish I had known this sooner, because the truth is, the first food that concerns me most is one that carries an almost perfect health reputation. I am talking about flavored yogurt, the kind sitting in every refrigerator, with fruit on the label, a heart symbol sometimes printed right on the carton. People eat it every morning, confident they are doing something good for themselves. And here is where the betrayal happens. Flavored yogurts are full of added sugar, with links to weight gain, high blood pressure, inflammation, and heart disease. The plain yogurt underneath? That is genuinely good food. But by the time manufacturers add fruit puree, syrups, and sweeteners to make it palatable, some single-serving containers carry 15 to 25 grams of added sugar. Added sugars cause blood sugar spikes, contribute to insulin resistance, and increase the risk of obesity and type 2 diabetes, all of which directly stress the heart. Now, for a body over 60, insulin resistance is not just a metabolic inconvenience. It is a slow fire. Because when your cells resist insulin, your pancreas, think of it as a pump that is already working harder with age, responds by pumping out even more insulin to compensate. That chronic state of elevated insulin triggers inflammation throughout your vascular system. And inflammation in an aging artery is like rust on old metal. It does not stay quiet. It spreads. The second food hiding behind a health halo is perhaps even more surprising. Processed deli meats, turkey slices, lean ham, low-fat salami, are commonly chosen by people over 60 specifically because they are trying to be heart smart. Lower calories, high protein, convenient. But what those labels do not lead with is the sodium content. Processed meat is high in sodium and nitrates, which can damage blood vessels and increase blood pressure. And there is something else happening in that meat beyond sodium. Trimethylamine N-oxide, known as TMAO, is a dietary byproduct formed by gut bacteria during digestion, derived in part from nutrients abundant in red and processed meat. Research has shown that TMAO enhances cholesterol deposits in the artery wall, and studies suggest the chemical interacts with platelets to increase the risk of clot-related events, such as heart attack and stroke. A patient I worked with, a 63-year-old man, active, health-conscious, was eating deli turkey almost every day for lunch. He thought he was miles ahead of his peers. But his arterial inflammation markers told a different story. And the third food on this list, this one genuinely surprised me the first time I saw the data. What changed everything for me, and what should change everything for you, is the story of the third food. Because this one hides behind some of the most powerful healthy branding in the food industry. I am talking about commercially prepared fruit juices and smoothies, not the ones you make yourself at home with whole fruit, but the bottled, packaged versions that line the health food aisle. Now, before I explain what the research says, let me ask you something that I want you to sit with for a moment. Have you ever poured yourself a glass of orange juice in the morning and felt genuinely good about that choice? Most people have. It is colorful. It feels natural. It is made from fruit. The marketing is immaculate. So what is actually happening inside your body when you drink it? Whole fruit contains fiber, and fiber is the critical factor here. Think of fiber like a speed bump in your digestive highway. It slows the release of natural sugars into your bloodstream, keeping insulin spikes gentle and manageable. But when fruit is juiced commercially, that fiber is stripped away completely. These processed products are stripped of fiber and nutrients, causing quick spikes in blood sugar, and over time, they promote belly fat, which is particularly dangerous because abdominal fat increases heart disease risk in older adults. What you are left with is essentially a high-speed delivery system for concentrated sugar, hitting your bloodstream rapidly, triggering an insulin spike, and over time, raising a type of fat called triglycerides in your bloodstream and fat tissue, which increases your risk of heart disease. I had a patient, a 66-year-old woman who was meticulous about her health, who drank 2 glasses of commercial orange juice every day because her doctor had told her decades earlier that it was full of vitamin C and good for her immunity. She had no idea that the fructose load she was delivering to her liver every morning was quietly elevating her triglycerides. NHLBI-funded researchers published one of the largest, most comprehensive studies to date, linking ultra-processed foods and added sugar products to cardiovascular disease, the leading cause of death in the United States. These are not fringe findings. This is where the mainstream research is now pointing. And knowing it, really knowing it, gives you something far more powerful than fear. It gives you choice. So let me shift now from what to be aware of to what you can actually do. Because awareness without action is just anxiety, and I am not here to leave you with anxiety. I am here to leave you with a plan. The first and most immediate shift you can make is with your morning yogurt. The fix here is not to give up yogurt. It is genuinely one of the better protein and probiotic foods available. The fix is to choose plain, unsweetened Greek yogurt and add your own fruit. Real fruit. A handful of blueberries, sliced strawberries, a few pieces of mango. When you eat whole fruit alongside yogurt, rather than industrially sweetened fruit puree mixed in, you get the natural sugar arriving with its own fiber intact. The difference in what that does to your blood sugar, and therefore to your heart, is significant. Vegetables and fruits are good sources of vitamins and minerals, low in calories and rich in fiber, and contain substances that may help prevent heart disease. Your second action step addresses deli meats. The swap here is not complicated, but it is worth doing deliberately. Much of the sodium in the average American diet comes from canned or processed foods, including soups, baked goods, and frozen dinners. Preparing your own protein at the start of the week, a roasted chicken breast, a batch of hard-boiled eggs, canned low-sodium tuna, gives you the same convenience, without the sodium load, and without the processed nitrates working against your blood vessels. Lean protein sources such as poultry, legumes, and tofu are recommended, and limiting red and processed meats reduces saturated fat intake and lowers cardiovascular disease risk. I had a patient, a 64-year-old man who had been eating deli turkey for 20 years, who made this single swap and within 4 months saw a meaningful drop in his blood pressure readings. One change, not a complete dietary overhaul. One deliberate, targeted change. The lesson there is worth holding on to as we move into the second half of what you can do about food number 3. Because the juice conversation is where I see the most resistance, and also, honestly, the fastest results when people finally make the change. And here is the part I want you to hear clearly, because it is practical, and it is real, and it is worth sharing. For the juice and smoothie problem, the answer is not to stop eating fruit. Fruit is genuinely good for your heart. The research on whole fruit is consistently positive. A study showed that eating 2 servings of fruit and 3 servings of vegetables per day may lower your risk of cardiovascular disease by as much as 12%, because these foods contain fiber that effectively lowers cholesterol and blood pressure while improving blood vessel function. The answer is to eat the fruit, not drink a commercial version of it. Put a whole orange on your breakfast plate. Eat it with all the pulp, the segments, the fiber that nature packaged it with. When you drink a bottle of commercial juice, you are often consuming the equivalent of 3 to 4 pieces of fruit, without the fiber that would have paced that sugar absorption. When you eat a whole orange, your body handles it completely differently. Anti-atherogenic diets low in saturated fat and rich in fiber tend to normalize serum lipids, meaning they actively work to bring dangerous cholesterol back toward a healthy range. That is the kind of outcome we are working toward. Now, I want to pause here and say something directly. If you have ever been told by a doctor, or a nutritionist, or a well-meaning family member that flavored yogurt, deli turkey, and store-bought juice are completely safe and healthy choices, and you are sitting here right now realizing that the full picture is more complicated than that, I want you to type the word SAME in the comments below. Because you are not alone in this. Not even close. The number of people I have seen in my own practice who were doing all the right things they had been told to do, while unknowingly creating a cardiovascular burden, that number is not small. Diet may contribute to hypertension through an excess of calories, saturated fat, cholesterol, or salt, and a deficiency of potassium, calcium, and magnesium. Knowing this changes where you look, and where you look changes what you eat, and what you eat changes what happens inside those arteries every single day for the rest of your life. That is not a small thing. That is everything. You just spent real time learning something that most people scrolling past this video will never know. And I want to acknowledge that, because choosing to sit with information that challenges what you believed was safe takes something. It takes the kind of honest curiosity that most people lose somewhere along the way. The important role of diet in the prevention of disability and premature death and aging is a well-recognized and accepted reality of geriatric care. But recognizing it and actually applying it to the specific foods on your specific table are two very different things. And that gap is exactly where I wanted to reach you today. Here is the honest summary of what we covered. Flavored yogurt, trusted, marketed as wholesome, eaten by millions of people over 60 every single morning, carries a hidden sugar burden that stresses your heart through blood sugar spikes, insulin resistance, and inflammation. Processed deli meats, chosen by health-conscious seniors specifically because they seem lean and responsible, carry sodium loads and gut-generated compounds that damage blood vessel walls and raise clotting risk. And commercial fruit juice, sitting in the health food aisle, decorated with images of orchards and sunshine, strips away the fiber that makes fruit safe and delivers concentrated sugar straight to a liver that is already working harder with every passing decade. I made this video because I kept seeing the same pattern in my practice, in the research I was reading, and honestly, in people I care about personally. People doing their genuine best with information that was incomplete. People trusting labels. People trusting habits. And paying a price they did not know they were paying. Small dietary changes can lead to significant health benefits, and research consistently shows that adopting a heart-healthy diet can lower blood pressure, reduce cholesterol, decrease inflammation, and promote better circulation, all of which contribute to a longer, healthier life. I want you healthy, not just surviving, actually healthy, actually thriving, actually waking up in the morning with a body that feels like it is on your side. That matters to me more than I can really explain in a YouTube video. If something in this video felt familiar, if it felt like it was speaking directly to your life, your kitchen, your morning routine, please share it with someone you care about who needs to hear it too. And if you want to keep learning together, stay with us. I will be here.